Good morning. It's the link on the breeze, 93.9. The 648. Let's go to the KUAM News Zoom room where I gotta just say, just for clarity, because someone had mentioned it yesterday. One of the guests on the show had mentioned our sanitizing duendes.
Mm-hmm.
For those of you who don't know, duendes they're the little Smurfs of Chamorro folklore, right? But they're not blue; they're brown. And it actually they're similar tales in a lot of different indigenous cultures, right? The Philippines. What are they called in the Philippines? Duendes. Oh, what? Yeah. So I just gotta say, because I always say they go and they sanitize everything, but we don't really have sanitizing duendes, okay? Or do we? It's definitely clean in there, though, right, Dr. Lombard in our KWM News Zoom room, Dr. Peter Lombard.
Good
Morning.
morning.
Happy Friday.
Happy Friday. Does it smell like Lysol or Clorox in the Zoom room?
Uh, my smell I think is still okay, but I'm not smelling either right
I
now.
hope so, because if you can't smell anything, that's one of the symptoms. 648. Of course, we've been bringing on Dr. Lombard back when the show was called Containing COVID, and he's made a hobby out of crunching these COVID stats, Doc. And we last spoke to you a couple Fridays ago. It was a very sobering conversation. You predicted that we would see 9 deaths in the following week. We saw more than that, right? How many did we see, Doc?
I think we saw, man, boy, it's been like 12, I think, 12 in a week.
Right.
That was, a few more than expected based on the methods that I was using to calculate. Can you hear me okay?
Yeah, we can hear you pretty good. Yeah.
Okay.
Doc, let's
Yeah,
just...
so
But
it's we're a little bit ahead of pace of what the infection fatality rate would predict based on the ages of the patients we're getting as positives. I think that's, if you look at the ages of the people that have passed recently, they're actually on the younger side rather than over 60. There's surprisingly high numbers below 60, and I think that's the main reason. That being said, we still are very, very lucky. Our overall fatality rate, I think, is somewhere around 1/10%. And that's about 5 to 6 times less than you would expect. The CDC, the WHO, they're all saying, the numbers up to this point are somewhere around 0.6%, and we're at 0.1% right now. So I think, and that's doing an extrapolation of the total infected, not just the numbers of positives we have, but saying how many more than that were actually probably infected that we didn't know about. That's the number you have to use as your denominator, and then divide deaths into that. So if you use that number, we're about 5 to 6 times less. So even though 40, 50 deaths is certainly very tragic, it could easily be 250 to 300 deaths, and how much more sobering and challenging what things have been for us the past few months if we were at that point already. Now, why we're so lucky in that regards, is it leadership? Is it the fact that we're on an island? Is it we're doing some things right? I think probably the biggest part of it is our median age in Guam is on the younger side. That's probably the biggest effect, but we're still very, very lucky. And even if we continue to trickle in with 5 to 10 deaths a week, right now our 7-day average, we're looking at about 40 cases a day, which is it's come up a little bit over the past 2 weeks. We had a peak in our weekly cases at the end, about a month ago, at the end of August, and then things came down over 2 weeks, and they're very slowly trending up again. Hopefully that plateaus, and it's pretty remarkable that despite the PCOR 1 lockdown and things aren't still going down. One of the rules of thumb that we use is for our 10% case positive rate, if you're detecting 50 cases, the actual number of active cases that are out there is probably about 8 times that. So if you imagine 400 cases walking around active on a single day, and if you do that every day for 10 days, which is roughly average for the number of days somebody will be infected. That's 10 times that. We've got 3,000 to 4,000 people walking around active, and that's just a tremendous number.
Right.
We also talked about a little bit the overall prevalence in Guam. I was actually shocked to see, if it's true that we've reached about 20% of our population having had or been exposed to and now presumably immunized, at least for a few months, to COVID. 20%, if you look at the US, is one of the highest, and to only have a fatality rate of about 1/10 of 1% is actually extremely good. Even New York State, I think, is the only state that I could see that actually had a higher overall prevalence of infection. So that's the only silver lining here, is the fact that if we keep seeing about 550 cases a day, our overall prevalence will increase by 1% about every 5 days. And the higher we get, the easier it's going to be to contain flares. We're still going to have cases. There's no doubt that we still have too many people that haven't been infected, that we're still going to have cases, but it will be easier to prevent these rapid surges and these situations where the hospitals may really be stressed again, like they were at the end of last month.
Right. Doc, let's just ask your opinion, right? So we've been in this PCOR 1 lockdown for 7 weeks, right? The numbers have continued to climb, and we've had these easing of restrictions. We were told that they were going to open things up and that it was going to be closely monitored, but we haven't really heard anything about the monitoring that they're doing, or the positives that are coming from this monitoring. And then today we get the announcement that tomorrow there's going to be even more openings. They're going to indoor masses, gyms and fitness centers. You can now congregate up to 5 people. Parks and beaches open. Is it concerning to you that we continue to flip open the switch and we haven't really gotten a handle on this surge, as we now saw 60 some positives? I mean, just yesterday.
Yeah, I think you said we were very lucky with what we have, right? The numbers we're seeing, but are we pushing our luck?
Well, I would feel a lot more comfortable if public health or somebody gave us a little bit more context into the decisions, and we're just not seeing that. I have to believe public health has a lot more data about where these cases are coming from, at least something, and all we get are, probably the most useful information we get are the people that come on your show. If you're not tuning in, you wouldn't hear little nuggets that are important. Is there any data behind saying, hey, we think that if gyms do these things, they're going to be safe? Do we think that if the daycares do certain things, they're going to be safe? Or did they see a number of cases from daycare? It is a little bit paradoxical to me that, the governor very, very strongly kept saying she was going to keep things locked down. And then to allow for these very measured and, incremental openings, especially in light of the fact that, the cases we're seeing now are higher than they were when we started PCOR. So that part I don't understand, her thought process, or whoever's making the calls. I actually think it's okay. My personal opinion, I think that the things that they're incrementally opening are okay, because I don't think they're a huge driver of spread of infection, especially if they're taking the appropriate precautions. I don't know if you guys are the same way, but again, look at 1 out of 5 people in Guam have had it. Perhaps 4,000 people walking around. Look at your own workplace, and 1 out of 5 people, probably have been exposed or have the virus. And in my own workplace now, we're up to three people that have had it, and it's everywhere. I mean, I've heard of medical clinics, department stores, fast food restaurants. I think that the virus is everywhere to some degree. We're all having to learn how to rapidly adapt when somebody in the workplace tests positive, and how the workplace responds to that. It's a big challenge for employers, for co-workers to have fill in for their staff, and getting them back as soon as possible is a challenge. I like to think that even with these incremental relaxations, that we're still going to be able to maintain this level of now hopefully 40 to 50 cases a day. I've heard Lillian Posada, she says about 20% of those may need hospitalization. So you're looking at, maybe 5 to 10 admissions a day if we keep those numbers, and maybe 1 out of those will need ICU care. So 1 ICU admission a day on average, and are we discharging the same numbers? That's what we need to look at if we're gonna be able to keep the hospital system at a place where it's not overwhelmed. As we slowly march towards a higher overall prevalence, hopefully we're also able to keep our deaths down. It really comes out. I had to tell my parents, it's hard not to see them, and I have to look myself in the mirror and say, am I doing the right thing? And I have to tell my mom and dad, not to come over and spend time with the kids. And it's hard, but that's, those are the hard choices we have to make in our own circle of friends and family, if we want to protect the people that are most vulnerable and most likely to succumb if they get infected.
I totally agree with the lack of information. I just feel like we had a laugh this morning, governing by executive disorder. I mean, I just feel like we put out these executive orders. We don't hear anything. I mean, the governor hasn't even been like, hey, how you guys doing? It's just like, open. Okay, we're going to open this. And I just feel like when you talk about measured openings, we still haven't even really seen the impact from the first easing of restrictions that we did. And you're right, we haven't had any data. It's at a point, Doc, that we're just grateful. And I will just be really, really nice to public health to make sure that we get someone from public health on. It used to be every couple of days. Now we're just doing once a week on Friday. So you're right. It's really problematic to me that these huge pronouncements are being made from on high at Adelup, and they throw out these executive orders, and we're left to sift through it with no guidance from the governor, no explanation. You're right. There's no data. No. I mean, I could understand.
Yeah. I also want to just point out, during that oversight hearing with public health, I'm not sure if you saw it, but I just kind of got a little bit of it. And there was one part when Dr. Ann Pabutsky was being questioned, and there was something that she said which I thought was very interesting, and she's going to be on a little later, but she was talking about the physicians advisory group, and how, I want to say she said there's only 2 people from public health that are actually on that board, and the rest are comprised of private physicians. And so they're the ones, who primarily have the ear of the governor, and giving her, and in which she bases her decisions. Yeah. And so I just wanted to throw that out there, because I know everybody's like public health, but they really, they only have two spots on this.
They should have more of a presence. I'm also concerned that they don't, public health, I mean, there used to be what looked like a lot more independence when Linda DeNorsi was kind of running the show. But then when you talk to the PAG, though, Bree, it's like we're told by like public health that the PAG advises the governor, but whenever we talk to the PAG, they're like, oh, we tell her, but it's ultimately her decision.
Right. Yeah.
Yeah. I don't know. It's I've heard that. I've heard that everybody's mostly on the same page in the PAG, and they put their recommendations for it. I think that, early on we didn't know what was going to happen, and I think we were all very concerned. And now I've come to a place of just acceptance that we're just not going to get explanations. We're just not going to get the type of information that would just help us to process what's happening, process the daily numbers a little bit better, process the executive orders a little bit more. I think they just want us to push the I believe and I trust button. And, on one hand, again, we're doing well, maybe 1% fatalities, that's good. And for that reason, maybe we shouldn't question what's going on. But, we're all thinking people, and I think we all want to understand what's happening a little bit better. It'll help us make better decisions in our lives. It'll help the providers in our daily dealings with our patients, and being able to give them better advice, because they're coming to us with questions, and we don't know any more than you guys do necessarily. I think there's a small group of people, maybe in the PAG and public health and within the governor's circle, that has access to more information, and maybe everything makes a lot more sense to them. But it's just too much trouble for them to try to explain things, or they don't want to have to deal with the fallout or the questions and the criticisms, or the analysis that might come from the woodworks, like from us, and they just don't want to have to deal with that. So
that's the life you chose, though, right, Doc? That's the life you chose.
Yeah. That's true. There's certainly that sentiment that, hey, you're a public figure. You got to
Right.
be willing to stand up to the
Totally.
criticism and take those questions,
Yeah.
right?
Doc, with the PAG, right, and we talk about lack of information, I think it kind of goes back to the transparency where if these meetings were open to the public, then we would have a better idea about what's driving these decisions. I mean, it could be something as simple as one guy talking louder than the other guy. We don't know. You
Yeah.
know, and this
And they've
argument that, and I, you know, and again, I appreciate that we get Dr. Wen on the show because, I mean, it's great. We do get that information from these meetings. But at the same time, this argument that, oh, if we open it up to the public and the public can watch the meetings, then no one's going to say what they really mean. And, well, tough. You know what I mean? There's a process with all the other boards that, you know, the public can key in on these meetings. And, you know, I mean, to me, it's just if they were transparent and we could see, if they're not going to give us the data or explain any of this logic that goes into the decisions, then
it's gotten so bad that the whole issue of quarantine, for example, is in court. And they want answers and explanations. Says, how is quarantine effective? Can you explain? Can you explain? And then it may get to the point where they have to subpoena the state surgeon cell to come in just to explain.
Right. Yeah.
It,
And how's that, Doc? I mean, they were so they first tried to get him, and then they said, "Oh no, he's under the guard with DO." Talking about the surgeon, what is he, Surgeon General or
state
surgeon, Dr.
cell.
Mike Cruz. So they were having the hardest time getting him to show up in court to testify about this quarantine, and now they're. I think the AG's office is like, "Oh, if you want to send a subpoena, then send a subpoena." Which is crazy. Like, we've never had Dr. Mike Cruz on this show. You know what I mean? And for
Exactly.
someone who is key, I mean, he's like the COVID czar, basically. No accessibility, no transparency, no ability to ask questions. It's crazy. It's actually pretty crazy.
It's kind of, I mean, it's a little disappointing. I mean, talk about an opportunity to be a leader and to stand up and be, you know, be the voice that people come to and listen to. It's a wasted opportunity, and it's a bit of a vacuum in terms of leadership and sanity and knowing, you know, what you know, how are these decisions being made. And in his position, I don't know, you know, what his, you know, reasons for not putting himself out there a little bit more. You know, maybe he's got his personal reasons for that, but
you can't be personal during a pandemic. That is
Sorry.
ridiculous.
Yeah. And
There are people out here dying.
Yeah, and you know, Doc, it's worse than pulling teeth. Like, you know, and we've had a good working relationship with Dr. Cabrera, and a couple weeks ago, you know,
but he's been in court.
Right, he's been in court, right? And a couple weeks ago, we had it set up where Dr. Cruz was going to come on, and it was like a last minute thing. They're like, oh yeah, cancel, and we just never got anything after that. Like, is he going to come back on or what? I just feel like if they're not going to explain these decisions and at least give us the opportunity, because they don't want to do a press conference, because every time we ask the governor a question, she gets pissed, and you can see it. So I think Doc, what it is they can't explain the logic behind these decisions because maybe there isn't any.
Well, I'd like to give them a little bit more the benefit of the doubt. I think there is probably data behind what they're telling us, but they just don't want to. They don't have the patience to try to explain it to us, or don't think that it's going to go over well, no matter what they say. And I get that too. I mean, it doesn't matter what they say; somebody's going to have something negative to say about it, and they've got to just not deal with that. And
that's a
whether
shame.
or not that's justified,
a shame.
you know. Yeah.
You should be able to answer, you know, to your decisions and explain your decisions, good or bad.
Yeah,
I mean,
that's basic, and
I think people would be understanding when you explain, you know, the rationale behind things.
I think the majority of people would be understanding. And again, here's an opportunity to build trust and to build to improve that transparency, so that people do believe it, and they do start to trust the things that are said and being made, and even more willing to give you the benefit of the doubt. But you got to earn that trust by being transparent and by explaining things.
Yeah. I mean, when people are hungry, businesses are shutting down, people are dying, positive cases are going up, people are in the hospital fighting for their lives. I don't think it's unreasonable to ask our top leader of this island and people who are leading this COVID response to come on or even hold a press conference
Jesus.
It's
Yeah.
plain.
Yeah.
I'm tired. I quit asking. I quit
I'll say
asking.
this too, though. I mentioned, we're lucky that our fatality rates is as low as it is, but how much better things could have been if we had better contact tracing, if we had better hospital facilities set up, and if we're an island, and could we have been a New Zealand or a South Korea if we had done things a little bit better? So that's the flip side of all this. We're lucky to be where we are. Things aren't worse, but man, things could have been potentially a lot better too.
I want to read this. I was texting with Dr. Hoa last night, and he's coming on. But he put, our positivity rate is going up. Companies are making big mistakes of allowing employees to return to work while tests are pending. Need to spread the word to companies that if you have your employees tested due to close contacts, they all need to be sent home while tests are pending. And if your household has a positive case, then the rest of the other members of the house need to stay home and inform their respective employers that they have a positive family member. See, when you get information like that, it makes me wonder if that's what's happening, then why don't we kind of get a hold on that before we open a bunch of other things?
Yeah.
Yeah, but we're blaming it on the businesses now?
No, they're not. We're just people who got to work. So maybe they're just going to work when they're I mean, I don't know. You said yourself earlier, Doc, it's a struggle when someone has to get tested or pops positive. Of course, in any business or company, it's going to throw a wrench in the whole operation.
Absolutely. It throws a tremendous wrench, and just having to deal with that now week after week is very challenging. And I can understand, people want to go to work. They run out of their FFCRA leave. They run out of their sick leave for having to stay home with their kids. You get a cough or a sniffle, and you're obligated to stay home and get tested. And and even if you're negative, sometimes they still make you quarantine just based on your symptoms. And it's untenable for long term. And I can understand why some people are going to push that boundary. It's a risk. Again, if you want to keep yourself and your family safe and our loved ones safe, you've got to take symptoms seriously. If you have a fever, cough, the classic symptoms, you just cannot put yourself out there in a place where you're going to be exposing other people. I mentioned we've had 3 cases in my clinic. We've got 30 or so employees, so roughly 10% as far as we know. And as far as we know, nobody that was positive in our workplace spread it to anybody else in the workplace. Okay, so take that for what it is. And we all mask up, of course. We're doing social distancing, and so I think from one perspective, if you're doing the right things in the office, at least you're going to protect one another, and that's important. But I've also heard that there are some places, some facilities businesses where it has spread within the office and space. So. And that's likely because of what Dr. Nguyen mentioned is people are coming to work and they're sick, and that's something that message certainly has to get out there. But I do think that businesses can open safely, and I think we have to allow for that to happen. At the same time that we're stressing the importance of making the right decisions.
Yeah, and I think what's problematic is, I agree, we definitely can't go forever with businesses being closed, but I'm just not confident the government of Guam is doing their part to improve the COVID-19 response on the virus end of things, right? I get the whole economic argument, and I was at Ross yesterday. Place is clean. They have a ton of employees. I mean, you look at something, they spray it down. So businesses are, they are doing their part. But what is also concerning is if, like you had said, so many people are walking around active, and these people are going here, they're going there, going there. I see that as a problem, and I'm not trying to say it's the businesses. I'm just saying if you have a lot of positive people and they can now go all over and do all kinds of things, then I'm just assuming that we're going to see spread. So it really comes down to us just policing ourselves, and we're not getting any help.
Yeah, at the end of the day.
Yeah.
We're fending for ourselves.
A lot of us are asymptomatic too. Of those 3,000 to 4,000 walking around that are active, potentially 30 to 40% of them are asymptomatic. So, you can't blame them for going about their business and going to work, but that's where the universal, precautions that we're talking about with masks and washing your hands and social distancing, that's where those things really are going to pay benefits for us.
Well, Doc, don't really want to ask what your predictions are for deaths in the coming week, but what's your prediction?
Or what are the numbers showing?
I think my numbers had shown 47 by Sunday, so we're already past that. So the week after that, based on last week's numbers, would be another 6 deaths. So that one-ish per day is looking, like if the numbers stay where they are, we're about 12% of all of our cases are over 60, and that's really the driver of most of the fatalities. 10 to 12%. We've been staying around that number for the past few weeks. The highest it was about 14%, but we've been about 12% for the past few weeks. So if that holds the same and the numbers hold the same, I think we're still going to be looking at 5 to 10 deaths a week, unfortunately. But again, better than perhaps we deserve.
Well, there you go. Thanks, Doc.
All right,
Thank
guys.
you.
Thanks for having
Be
me on.
safe.
All right.
Right on. Wash your hands.
Take care.
7:13.